Hello, so I would like to talk a little bit now about polycystic ovaries when you're trying to conceive. So this is something that is very, very common. So some people know that they have PCOS, they have the full-blown syndrome. So the characteristics of that are that you could be overweight or struggle to lose weight. You might have facial hair, you might have acne. So I do see that presenting in my clinic, but I also see many women who don't have those symptoms and who may have polycystic ovaries or ovaries that are behaving in a polycystic fashion. So it can really massively affect your menstrual cycles. So your cycles are typically much longer. Sometimes I have seen people who can have like 46, 47-day cycles. You don't always know when they're going to be. They're not like every 46 days. So they could be 46 days 1 month and then 37 days, and they just jump around, which obviously makes it really hard if you're trying to conceive naturally, because basically you don't know when you're ovulating, you don't know when your period's going to come, you don't know if you can test, when you can test. I have seen patients of mine, conceive, who have had those really, really lengthy cycles. But the other thing it kind of means is that basically you are limited in the amount of goes that you get. So for somebody who's on a 28-day cycle, then you have potentially 12 chances per year to conceive. If your cycles are much longer than that, then your chances are going to be less than that, because you're going to have less cycles, less ovulations in a year. So sometimes women with PCOS have gone straight to IVF once they've realised that that's a problem for them, or maybe that they decided, they knew that they had PCOS and they were going to go for IVF right from the start. So if you are having IVF and you have polycystic ovaries, then you are most likely to respond very, very well to the stimulation phase. So what they are doing now more recently is for people who are going to respond that well, you're going to get a lot more eggs, which is obviously good, but it also means that you've got a lot more hyperstimulation going on in your ovarian region, so that can be very uncomfortable and painful. So now most IVF clinics, if you have got PCOS or polycystic ovaries, they will offer you a frozen embryo transfer, and this is recognised as giving you your best chance, because it actually gives you a chance to have a rest and for your body to kind of repair and go back to normal. So this is something. Coconut water is great if you're taking IVF drugs and you've got PCOS, because that does really help with the stimulation. The overstimulation. And acupuncture is a great support whether you have PCOS and you are trying naturally, if you are just trying to regulate your cycles and make your cycle shorter. It's kind of kidney, yang and damp for us, so we will talk to you about diet and lifestyle and exercise and everything. And if you are actually going through IVF, then acupuncture can also help you as well. So whether you're trying naturally or going through IVF, if you have polycystic ovaries, then acupuncture can be, really supportive in this situation.